Assalamu alaikum. Our lecture today from the infectious disease module is Bordetella species. Genus Bordetella. Introduction. There are several species of Bordetella. Bordetella pertussis, a highly communicable pathogen of a human that causes whooping cough or pertussis. Whooping cough or pertussis معناتها مرض السعال الديكي. Bordetella parapertussis that cause similar disease but it is mild, and Bordetella bronchiseptica that causes diseases in animals. We're gonna talk about Bordetella pertussis that cause pertussis or whooping cough. Morphology and identification of Bordetella pertussis. The organism are gram-negative coccobacilli resembling H. influenza. When we stain the bacteria with toluidine blue stain, bipolar metachromatic granules can be demonstrated. The bacteria is capsulated. Culture. We use a rich media for culturing Bordetella pertussis, which is boarded jingo media that contain potato, blood, glycerol agar, and contain penicillin G. The plates are incubated at 35 to 37 degrees centigrade in the incubator for 3 to 7 days. In the moist environment, we can see after incubation, the small faintly staining gram-negative rods are identified by immunofluorescence staining. Bordetella pertussis is non-motile bacteria. Growth characteristic of Bordetella pertussis. The organism is strict aerobic. It does not require X and V factor on culture like Haemophilus influenza. The virulence Bordetella pertussis produce hemolysin enzyme, so we can see hemolysis on a blood-containing media. Variation. We have two types or two phases of Bordetella pertussis, virulence phase and avirulence phase. Virulence phase, when freshly isolated from the patient and culture of a rich media, Bordetella pertussis is in the hemolytic and pertussis toxin producing virulence phase. So virulence phase, the bacteria produce hemolysin enzyme, so we can see hemolysis on blood-containing media, and the bacteria produce toxin. While at the virulence phase, non-hemolytic on a blood-containing media and non-toxin producing a virulence phase. There are two mechanisms for Bordetella pertussis to shift to non-hemolytic, non-toxin producing a virulence phase. What are these mechanisms? Reversible phenotypic modulation occurs. This reversible phenotypic modulation occurs when Bordetella pertussis is grown under certain environmental conditions. What are these environmental conditions that we can convert the virulence phase to a virulence phase? Is 28 degrees centigrade versus 37 degrees centigrade in the incubator, and the presence of MgSO4. So we can convert the virulence phase of Bordetella pertussis to a virulence phase. What are the antigenic structure of Bordetella pertussis? Filamentous heme agglutinin that mediate adhesion to ciliated epithelial cell of the respiratory tract, pertussis toxin, adenylate cyclase toxin, dermonecrotic toxin, and hemolysin enzyme. The tracheal cytotoxin that inhibit DNA synthesis in the ciliated cell, and also villi probably play a role in adherence of the bacteria to ciliated epithelial cell of the upper respiratory tract, and also it have lipopolysaccharide in the cell wall that may be important in causing damage to epithelial cell of the upper respiratory tract of a human. Pathogenesis of Bordetella pertussis. The transmission of Bordetella pertussis is largely by respiratory route and possibly by carrier. The organism adhere to and multiply rapidly on the epithelial surface of trachea and bronchi بواسطة الفيلامنتيوس heme agglutinin and possibly by villi اللي هي antigenic structure اللي شرحناها بالسلايد السابق. and interfere with ciliary reaction of the respiratory epithelium. The blood is not invaded. The bacteria is not invade the blood. The bacteria produce toxins and substances and enzymes that irritate surface cells, causing coughing and marked lymphocytosis. Later, there may be necrosis of part of the epithelium and polymorphonuclear infiltration with peribronchial inflammation and pneumonia. Secondary invader like Staphylococci bacteria and H. influenza may give rise to bacterial pneumonia. Clinical finding of Bordetella pertussis. There are 3 stages. After an incubation period of about 2 weeks, there are 3 important states of infection. The first stage is catarrhal stage, second stage is paroxysmal stage, and we have convalescence stage. The catarrhal stage develops with mild coughing and sneezing. During this stage, large number of organisms are spread in droplets and the patient is highly infectious but not very ill. Only mild coughing and sneezing in the catarrhal stage and the patient is highly infectious. The stage الثاني هو paroxysmal stage. The cough develops its explosive character and characteristic whoop upon inhalation. This leads to rapid exhaustion and may be associated with vomiting, cyanosis, and convulsions. The whoop and major complication occurred predominantly in infant. Paroxysmal coughing predominates in older children and adults. Paroxysmal coughing. The white BC is high and with an absolute lymphocytosis. الستيج الأخيرة اللي هو convalescent stage that is slow. Bordetella pertussis is common cause of a prolonged cough for about 4 to 6 weeks in adults. Diagnostic laboratory test of the microorganism. The specimens, a saline nasal wash is preferred specimen, the saline nasal wash. And also we can use nasopharyngeal swab or cough droplet, but the best sample is saline nasal wash. Direct fluorescence antibody test can be used to examine nasopharyngeal swab specimen. Culture, we use the media, Bordetella media, that contain antibiotic which inhibit another respiratory flora. Organisms are identified by immunofluorescent staining or slight agglutination of the specific antisera. We can use also polymerase chain reaction, which is PCR, is most sensitive method to diagnose Bordetella pertussis. Immunity. Recovery from whooping cough or immunization is followed by immunity. Second infection may occur but are mild. Reinfection occurring years later in adults may be severe. It is probable that the first defense against Bordetella pertussis infection is the antibody. من نحصل على هذا الانتيبودي؟ نحصله من الفاكسين أو نحصله من الباست infection. هذا الانتيبودي prevent attachment of the bacteria to the cilia of the epithelial cell فيمنع الانفكشن. The treatment. Bordetella pertussis is susceptible to several antimicrobial drugs in vitro. Administration of erythromycin during the catarrhal stage of the disease promote elimination of the microorganism and may have a prophylactic value. Treatment after onset of paroxysmal phase rarely alters the clinical course. Oxygen inhalation and sedation may prevent anoxic damage to the brain. So we use erythromycin and oxygen inhalation. Prevention. Every infant should receive the 3 injections of pertussis vaccine during the first year of life, followed by a booster dose for a total of 5 doses. يوجد نوعين من لقاح البرtussis. القديم كانوا يسموه whole cell vaccine that contain inactivated organism or pertussis toxin that used in the past اللي هو يكون أقل تكلفة لكن الآثار الجانبية أو side effect مالته أكثر. فقاموا ما يستخدموا هذا اللقاح، قاموا يستخدمون هسه اللقاح الجديد اللي هو cellular pertussis vaccine. هنا بهذا cellular pertussis vaccine يضعفون التوكسين يسووه توكسويد، بينما هنا كانوا يحطون pertussis توكسين، فلهذا السايد إفكت مالته أكثر. The cellular pertussis toxin licensed in the United States used this vaccine is recommended because it has few side effects. هذا دا نحكي على cellular pertussis vaccine اللي دا نستخدمه حاليا has few side effects، وأكثر طبعا أفضل هو من cold vaccine اللي كانوا يستخدموه in the past. The cellular vaccine that contain purified protein from the organism pertussis toxoid مو توكسين مثل كانوا يستخدموه بالسابق have at least two of the following antigen: inactivated pertussis toxin, filamentous hemagglutinin, or fimbrial protein and pertactin. Pertussis vaccine is usually administered in the combination with toxoid of diphtheria and tetanus. diphtheria tetanus ليش حاطي له أي يعني cellular pertussis vaccine اللي هو هذا اللقاح الجديد. وطبعا هذا يسموه هذا اللقاح 3 أنواع من اللقاحات يضيفوا له اللقاح مال هيموفيلس إنفلونزا أيضا. 5 doses of pertussis vaccine are recommended prior to school entry. The usual schedule is administration of doses at عمر شهرين الإنفانت and 4 months and 6 months، بعدين ينطون بعمر 15 إلى 18 month of age، and booster dose بعمر المدرسة اللي هي بعمر 4 إلى 6 سنوات. A prophylactic administration of erythromycin for about 5 days may also benefit an immunized infant or heavily exposed adult. ممكن ننطي prophylaxis من الأريثرومايسين. Epidemiology and control. Whooping cough is endemic in most densely populated area. The source of infection is usually a patient in the early catarrhal stage of the disease. Most cases occurred in children under age 5 years. Control of whooping cough rests mainly in the adequate active immunization of all infants. Bordetella, we have also another species of Bordetella, which is Bordetella parapertussis. This organism may produce a disease similar to whooping cough, but it is less severe أو mild infection يكون.